Welcome back, class. We're going to do motor control, chapter 4, and that's the physiological basis of motor learning and recovery of function. So we continue our talk of motor learning. So learning is the process of acquiring knowledge about the world. That's what learning is. We're constantly learning. Motor learning is the process of acquisition modification of a skilled action. Okay, so that's the difference between learning and motor learning. Make sure you know the definition of both. The physiological basis for motor learning, again, activities, distributed among many brain structures and processing levels. So it's not just one area of the brain that does motor learning. That's why we looked at chapter 3 and looked at all the different parts of the brain and what is responsible for each section. Now, the physiological basis for recovery of function is similar to learning. So learning and motor learning kind of go hand in hand, but there is a little bit of difference, and we'll discuss that. Okay, so the physiological basis for motor learning distributed among many brain structures and processing levels, as we discussed. The physiological basis for recovery of function is similar to learning in that recovery involves processes occurring throughout the nervous system and not just at the lesion site. So even though there's a lesion, let's say at the parietal lobe, we need to look at the processes around it. And again, you're not going into neurology and you're not going to become a neurologist, but you still need to understand the mechanism of injury, how that injury occurred, and what are some of the actions that can affect it. Okay? Now, we have to understand neuroplasticity. And plasticity is defined as the ability to show modification. Can it be modified? Is there any plasticity involved? So the continuum from short-term changes in efficiency or strength of synaptic connections to long-term structural changes in organization and numbers of connections among neurons. So how do we go from short-term changes to long-term structural changes? Is it repetition? Is it guidance? Is it verbal cues? Is it tactile cues? What is involved? Well, every patient is a little bit different, and as we go through this class, we're going to see how we can go from those short-term changes that you do in the clinic to long-term structural changes. It's not easy, and it doesn't happen overnight, especially with a neurological patient. Now, so again, defining neuroplasticity, learning is a continuum of short-term to long-term changes in the ability to produce skilled actions. Like we talked about last week, it's great that they can do it during a therapy session, but when they come back and they can't redo it or you're trying to teach them again, well, there's no long-term change that occurred. Now, recovery of function, the continuum of changes from short-term functional changes that occur immediately following injury to long-term changes. Now, so what that means is in order for us to have long-term change, we need increased synaptic efficiency that has to lead to structural changes. So you're thinking, well, how do I get increased synaptic efficiency? Well, that's the whole thing that we need to discuss, right? But you have to understand what's the basis of our rehab first. Now, learning and memory. You've heard about difference between short-term, long-term memory, but let's talk about it a little bit more in depth. So learning, again, is the acquisition of knowledge or ability. Memory is the outcome of learning. Can you retain, or retention and storage of knowledge or ability? You're probably saying, Patel, my memory sucks. Well, maybe your short-term memory sucks, but your long-term memory might be good, right? Long-term memory, you remember that your favorite pizza or your childhood memories or something, and you're like thinking, how can you remember some of those long-term memories? Well, did you associate with something good or something bad, right? You remember all those bad memories as well. So memory is very interesting, short-term versus long-term. What our goal is to get it from short-term to long-term, just like we do in studying. How do we get it from short-term to long-term? Now, implicit memory operates unconsciously and automatically. Those are habits and motor skills, right? So, like riding a bike. How did it become implicit memory? It's unconscious. You just get on that bike and it happens automatically. So you don't have to think about it. Explicit memory operates consciously. Those are people, places, and objects. You're trying to remember those people, places, and objects. So we have to figure out a way to go from explicit memory sometimes, which is conscious, to maybe implicit memory, which are habits and motor skills. So make sure you know the difference between explicit memory and implicit memory. And I'm going to talk a little bit more about that, of course. Now, short-term memory is momentary attention to something. That's your working memory. It has a very limited capacity. It lasts only a few moments. And sometimes with patients that are that have a TBI or stroke or any kind of neurological brain issue, they only have working memory, only short-term memory. Okay, so there are some things that we need to figure out and what's going on. Now, long-term memory, intimately related to the process of learning, seen as a continuum. So initially, long-term memory can reflect functional changes, and then later stages, it can reflect actually structural changes in the brain. So those are some things that we want to say, well, how do we get to those structural changes in the brain so we can keep those long-term memories? Again, we're dealing with patients with neurological issues here. So let's look at this, the process of forgetting and remembering. So let's say you feel something, you hear something, and you see something. Well, that's going to go in your short-term memory. And then your body's going to like, well, do I need to remember that or do I need to trash it? Okay, so they're like you see something, you hear something, you feel something. Short-term memory says, you know what, I'm done with that. Bam, trash. But if we have patterns, repetitions, and constant stimuli, then we can go into the long-term memory. So that's how you get from short-term memory to long-term memory. Just think about studying. You see it, you feel it, you hear it, and you listen to my lectures, you read the book, and then you're like, you take the test, and then you trash it. Right? Really, I mean, that's the whole point. Regurgitate the material, spit it out on a test, and then bam. You're like, all right, I'm done, Patel. Thanks for the A. But really, if you want to learn it for the long term, you got to have patterns, you got to repeat it, and you got to have stimulus over and over again. That's how you get into long-term memory. So take that into a patient care, neurological care. They need to see it, they need to hear it, they need to try it, touch it, and one therapy session after that goes straight to trash. But if you develop patterns, if you develop repetition, if you develop constant stimuli, then it's gonna go into their long-term memory. So that's our goal. So localization of learning and memory. Learning and storage of that learning memory involve parallel and hierarchical processing with the central nervous system. Information is stored in different areas of the brain. You know that. We talked about that. So we need to finding the engram. So engram is a physical representation or location in the brain of a memory. Okay, so that's what an engram is. So there's some kind of physical representation in your brain of a memory. So in 1920 and 1915, Carl Lashley spent 30 years trying to find the elusive engram, and in his seminal paper, In Search for the Engram, he concluded that memories are distributed, not localized. So there's not one area where you can find that, hey, this is where I ride a bike. Right? So this is what the people were trying to find, that elusive area, like, oh, there's just one spot in the brain where that's where I ride the bike. So I need to stimulate that. So he concluded that there's not one place, it's not localized. So in 1984, which is fairly recent if you look at it, showed that after conditioning rabbits to fear a tone with the air puff to the eye, removal of just a few hundred neurons from the intrapotus nucleus, a section of the cerebellum, led to fear extinction. Okay, so he found that there was a spot in the brain that we could say, okay, we stimulate that, and they were able to get rid of that fear if they stimulated a specific spot. So maybe there is an engram, maybe there isn't, right? So let's look at human memory in a nutshell. Okay, so if you look at sensory memory, it usually lasts less than a second. Short-term memory, which is your working memory, is less than a minute. Now your long-term memory is a lifetime. How do we get it from our short-term memory to long-term memory? And then even in a long-term memory, there's two different types of long-term memory. There's the conscious and there's the unconscious. So unconscious is procedural memory, such as skills and tasks, riding a bike, swimming. Explicit memory is your conscious, which are declarative memory, so facts and events, people. And then even from a declarative memory, there's two types. There's episodic, which are events and experiences, and then semantic memory, which are facts and concepts. So crazy, right? So basically you want to get from, let's say from a studying standpoint, from a education standpoint, we want to go into lifetime, then we want to go into explicit memory, then we want to study facts, and then probably we want to go into semantic memory, which are facts and concepts. So in order to do well, you need to find a way to get all these concepts into your semantic memory. So get it in your semantic is what I say. All right. Again, plasticity and learning. Plasticity and non-declarative implicit. So if you go back to implicit memory, which is unconscious, skills and tasks. Forms of learning, habituation. That's the simplest form of implicit learning. Decrease in synaptic activity between sensory neurons and connections to interneurons and motor neurons. Habituation is very important, and it means changing the efficiency of the synapses by repetition by modifying amplitude. Given to inner ear disorders, initially decline but then comes back, but with repeated practice, dizziness subsides. That's why it's important to tell patients to stick with the program to achieve long-term success. So let's say you were diagnosed with vertigo or dizziness. So the treatment for BPPV, benign paroxysmal positional vertigo, is you basically teach them to go into a little bit of dizziness and then come out of it. You go into a little bit of dizziness and then come out of it. So what you're trying to do is habituate so that when you do go into that certain thing, you don't get as dizzy. So your brain and your body is getting used to a little bit of dizziness. It's called habituation. Okay? Now, plasticity and non-declarative implicit, going again implicit. So if you say, what is implicit? That means unconscious. We need to sensitize them. It's a form of implicit learning, so caused by strengthening of a response to a stimulus preceded by intense or nauseous stimuli. So this may be short or long term, may involve exact set of synapses that shows habituation. Okay, so again, the dizziness example, your response to stimuli by intense or nauseous stimuli. So you're going into the dizziness, coming out of the dizziness, so you're sensitizing them to the stimulus. Now, associative learning, it's a form of implicit learning. A person learns to predict relationships. So you learn to form key relationships that help us adapt our actions to the environment. Maybe short-term or long-term, use as common cellular processes. It's very simple. So you associate learning. You associate certain skills with certain things, relationships. Okay. And then there's the classic conditioning that we've always talked about. And again, this goes into the implicit behavior. You get a reward for your behavior. Let's say, oh, if you do 10 sit-to-stands, you're going to get, I don't know, a high five. Or it doesn't even always have to be a reward, but you might be just something that gives them the satisfaction. Okay, so initially it's a weak stimulus. Condition becomes highly effective in producing a response when it becomes associated with another strong stimulus. Okay. Time is critical. It has to be less than 0.5 seconds. So Pavlov's experiment, the dogs salivate when they think of food. Or maybe associate a song to your loved one. Good times, right? Every time you hear, On Bended Knee by Boys to Men, it reminds you of your first love, right? So that's classic conditioning. You remember the good times. Okay, so you get a reward for behavior. That's classic conditioning. That's implicit. Now, there's operant conditioning. Again, these are skills and tasks. That learning involves development of predictive relationships. So same cellular mechanisms that underlie classical conditioning are responsible for operant conditioning. So classical and operant. Again, so subject has a choice, right? So Skinner with rats, levers, and food. So you have the choice of pulling one lever or the other. If you pull one lever, you get shocked. If you pull another lever, you get food. Well, eventually you learn that, hey, I don't want to pull the lever where I'm going to get shocked, and I keep pulling the lever where I'm going to get food. So with your patients, if they say, hey, if I do these exercises, I might get better. If I don't do the exercises, I might not be able to stand. So that's operant conditioning. Or you know what, every time I do 10 sit-to-stands, you know what, Patel gives me a high five or gives me a Snickers bar, right? I said it doesn't have to be food, but that's a reward. If I only do 9, he doesn't give me anything and he's kind of disappointed, right? So that's operant conditioning. You can do operant conditioning with your kids. Hey, if you get A's, you get $10. If you get B's, you get $5. So it's still rewarding behavior, but they know that, hey, if I get the A, then I get a little bit more love there. So operant conditioning. So again, procedural learning, learning and execution of both motor and non-declarative cognitive skills, especially sequences, occurs only when a movement performed by learners through trial and error and practice. So we have to do trial and error. Okay, so that's procedural learning. Now we talk about explicit forms of learning. So we talked about implicit, right? So what is explicit? Explicit is conscious. We talk about declarative memory. Okay, so explicit forms of learning, that's declarative learning. Results in explicit knowledge, requires conscious processes such as awareness and intention. The patient has to be aware, has to be conscious. Results in knowledge expressed consciously, can be expressed in a form other than that in which is learned. So you express it differently. It doesn't always have to be verbal. So declarative learning goes into your hippocampus, important in establishing memory, but not memory storage, critical for declarative learning. And that has a long-term potentiation, similar to mechanisms causing sensitization. Okay, so let's think about this. Let's give school as an example. Last week we had class, and after class you probably forgot 50-60% of what we talked about. That's normal, but think about that. It's called the ebbinghaus forgetting curve. So let's say I give you information, right? Let's say I give you a phone number or whatever the case may be. Well, immediately think about that. 20 minutes later, you're only going to remember 58% of the information. In 1 hour, you only remember 44% of the information. 9 hours, 36. In 31 days, really only 21% of the information. So what happens is that if you actually only study once in a while, you're not going to remember anything. So you have to find ways to overcome the curve, right? And that's same thing with patients. If we only see them once a week, they're not going to really get the benefits. They have to overcome the curve. So just like studying, you have to overcome this curve. How do you do that? Well, you got to think about this. Okay, so let's say classically you remember maybe 70-75%, and then within a month or something you forget. But that's where the reviews come in. Let's say immediately after class you review for 10 minutes, or 10 minutes after class you review. Guess what? You'll remember about 90% of that. But then if you wait another day, guess what? You're going to forget it 40% 1 week later, 1 month. But guess what? Let's say you immediately review 10 minutes afterwards, but then you don't do anything for a day afterwards. 24 hours later, then guess what? You'll remember 90% of it. And then you let it alone, and then maybe 1 week later or sooner, a couple days later, you review it again. Look at this. You're remembering 90% of it. And then a month later, you review it again. So here's the way that you make long-term success, right? This is how you remember things for the long term. You review, 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 review. Same thing with our patients, review. So here's what most of you do. You review it one time and then it's done. Take a quiz and then that's the blue line. That's not going to work. Okay? If you really want to do well in school, if you really want to retain the information, so right after class, review it at 10 minutes after class, then forget about it. Then a day later, review it again. 24 hours later, then a couple days later, and that's how you sustain it. Most of you are like, oh, I got a quiz on Tuesday or next Wednesday, I'll study Tuesday night. That's not going to work. Try this and tell me how you do. You'll have less stress and you'll be much better off. Trust me on this. Okay? I'm here to help you. All right, with that said, before you forget too much, so let's take a little break here.